Good day everyone! I am going to discuss how to assess eye structures and visual acuity. In preparation, the first thing you need to do is to assemble equipments and supplies, cotton tip applicator, examination gloves, millimeter ruler, pen light, Snellen's chart, opaque card. Now, let's proceed to the procedure. The first thing you need to do is to explain to the client what you are going to do, why it is necessary, and how she can cooperate. Hello ma'am, I am Lance and I will be your nurse for today and I will check or assess you for today. Is that okay?
Surely.
Wash hands and observe other appropriate infection control procedures. Provide for client privacy.
Next one is to determine client's history. Family history of diabetes, hypertension, eye disease, injury, or surgery. Last visit to an ophthalmologist. Current use of eye medication. Use of contact lenses or eyeglasses. Hygienic practices for corrective lenses. Current symptoms of eye problems. Do you have any eye diseases, injury, or surgery before?
None.
Inspect the eyebrows for hair distribution and alignment and for skin quality and movement. Inspect the eyelashes for evenness of distribution and direction of curl. Make sure the eyebrows distribution has no gap and is symmetrical to the other. And also make sure the eyelashes are evenly distributed.
Inspect the eyelids for surface characteristics. Position in relation to the cornea, ability to blink, and the frequency of blinking.
Inspect the bulbar conjunctiva for color, texture, and the presence of lesions. Make sure the color of the bulbar conjunctiva is white. Inspect the palpebral conjunctiva by averting the eyelids and make sure that the color of the palpebral conjunctiva is pink because that indicates a normal color. Inspect and palpate the lacrimal gland, lacrimal sac, and the nasolacrimal duct. Inspect the cornea for clarity and texture. Ask the client to look straight ahead, hold the pen light at an oblique angle to the eye, and move the light slowly across the corneal surface. Perform the corneal sensitivity test to determine the function of the fifth trigeminal cranial nerve. Ask the client to keep both eyes open and look straight ahead, approach from behind and beside the client, and lightly touch the cornea with the corner of gauze. It should blink because if it didn't blink, it means that the trigeminal cranial nerve is not intact. Inspect the anterior chamber for transparency and depth. Use the same oblique lighting used when testing the cornea. Inspect the pupils for color, shape, and symmetry of size. Make sure that they are equal in size. The normal pupil range is about 3 to 5 mm, and her is about 3 mm, and that is equal.
Assess each pupil's direct and consensual reaction to light.
Make sure that the room is dim. We will see how the pupil responds. Both eyes should constrict.
Assess each pupil's reaction to accommodation. 2 to 14 feet away from the patient's nose. All I want you to do is don't move your head. Just use your eyes to watch where the pen light is. By performing this, we will look for any involuntary shaking of the eye.
Lastly, document findings in the client record.